Hi, I'm Dr. Messina, president of Dr. Undo Tattoo. And does your tattoo sometimes itch and swell, especially if you're in the shower? Then this video is for you, because we're going to discuss why that could happen and how you can treat it. If by chance you don't have that problem, then take a look at some of the other videos where the tattoos didn't do that. And I promise, this video is going to be fizzy pop, low key, no cap. Don't you just love ticking off your kids? Sometimes you can have a tattoo that starts to itch shortly after having the tattoo placed. And guess what? That could be quite a normal occurrence. We have to remember, ideally, we have a sterile needle on sterile skin, placing a sterile ink right into your dermis, completely piercing all the levels of the epidermis. It's a foreign object being placed in your dermis. And that foreign ink in your dermis is going to initiate an immune response. And that immune response might be swelling and itching of the tattoo. Now, it's very important to avoid scratching it as much as you might want to, because you will further break the skin and increase the risk of getting an infection. It's going to get better, and it's going to get better in just a few short weeks. But there are things we could do. You could keep it cool. You could keep it moist using Cetaphil or Aquaphor. I don't recommend putting other types of emollients on there or any types of, let's say, vitamin C preparations and vitamin E, because it might interfere with the healing process and interfere with the ink itself. Now, unlike this normal reaction, if your tattoo happens to become infected, it's going to be a very similar process. At first, it's going to be itchy, and then it's going to become raised. You're going to see some redness and swelling around the tattoo, and it's going to become warm and tender over the next few days. If it keeps going in this direction, you're going to start to develop an exudate, either pus or some kind of a fluid coming out of the tattoo. That's an infected tattoo, and it's not a normal process. And you're going to have to get that treated, most likely with an antibiotic. Severe would be an IV antibiotic. Most of the time, an oral antibiotic will suffice. Probably not a topical antibiotic like bacitracin or neosporin, because remember, this infection is deep. It's gone to your dermis. So you're probably going to need a little bit more than a topical agent. So remember, if you get a tattoo, and over the next few days, it becomes itchy, red, hot, and tender, you might have an infection and you should get that checked. We could also now have a true allergy to your tattoo ink. Most of the time, it's the red ink that's the culprit, because red ink has a substance in there that many individuals are hypersensitive to. If you do have a tattoo allergy, it's going to present very similar. It's going to itch quite badly. It's going to swell, and you're going to get an erythematous or reddish base extending around the tattoo. Again, very important to resist scratching it. And there are a few things you could do at this point. You could put the cold compresses on. You could use a topical steroid, anti-itch cream. I wouldn't recommend a topical steroid for that first situation where it was normal healing. But in this instance, when we have an immune response, we can tamper it off with a little topical steroids. Antihistamines might work, such as Zyrtec or Allegra, provided you could take them. It will get better in time in the vast majority of the cases. Most of the time, your body is going to wall that offending ink off with a fine scar, and therefore the immune response is going to be diminished. And you're going to find that it's not itching so much anymore, and it's not swollen anymore, and even the redness might go away. Except when you take a shower and you vasodilate and you bring more blood to the tattoo, you might get that response again. It might start to itch, it might start to swell, it might even get a little red. Again, that's an allergic reaction, and those methods that I just mentioned can help reduce this problem. Now, on a rarer occasion, you're going to have a true resistant allergic response to your tattoo. It's not going to get any better. The redness is going to get worse, and it might become unbearably itchy. In that instance, when you have a true tattoo ink allergy. It's important to not laser it off because you might expose your immune system to a tremendous load of antigen. So unfortunately, those things should be surgically removed. Hopefully it's a small enough tattoo where you could just cut it out and suture it together. But a true severe allergic reaction cannot be lasered. Some with chronic skin ailments such as eczema, psoriasis, or extremely dry skin might have an increased incidence of having an itchy tattoo. It's just that baseline pathology in your skin not appreciating a foreign body in the dermis. Like the other instances, it usually gets better. But that's also a potential problem. Now finally, this is extremely rare, so don't think that you have this just because your tattoo is itchy. Some people have sarcoidosis, which is an immune pulmonary disorder. It's common enough that the average physician will have a few patients with it, but rare enough where you're not going to see it all the time. And for some reason, the immune response that occurs with sarcoidosis tends to give you problems with older tattoos, believe it or not. So if you have an old tattoo that all of a sudden it starts itching, it might be something else in your immune system that's causing this problem. But like I said, don't go running off and thinking you have sarcoidosis. That's a pulmonary issue, and you're going to know. You're going to have some shortness of breath, and you're not going to feel proper. So I hope that you understand now why some people's tattoos become swollen and itchy, especially in the shower or in humid conditions. If you do like this type of information, my videos on tattoo removal, medical topics, and aesthetics, give me a thumbs up, click subscribe, and I'll catch you at the future videos.